Today I'm going to talk to you about boundaries, communities, and things that can kill us all. I work for the Centre for the Study of Existential Risk in Cambridge. We're one of a small number of research groups worldwide that focus on understanding existential risks, those threats to humanity's survival, and what might be done to manage them. And I'm going to focus on pandemic disease threats. The most likely extreme disease threat is an influenza pandemic. A severe pandemic is expected to cause more than 100 million deaths worldwide, and between 200,000 and 300,000 deaths in the UK. To put that in context, the total number of deaths in England and Wales in 2016 was just over 525,000. A pandemic influenza outbreak is high probability. Indeed, it is viewed as inevitable. In assessing risks to national security over the next 5 years, the UK government ranks pandemic influenza as highest in both probability and severity. Even with multiple disasters around us now, we are far short of the suffering we could see as such a pandemic played out. And while the impacts in the UK could be devastating, we are still in a much better position than most of the world will be. It has been projected that in a pandemic of similar severity to the 1918 influenza, 96% of deaths will be in the developing world. We should shift both our physical and moral boundaries to the level of humanity. Physical boundaries have no practical relevance in the face of existential risks, and a shift in moral boundaries may be key to our collective survival following a globally catastrophic event. What you do locally can make a difference. Again, taking pandemic influenza as an example, societal responses will have significant influence on the course of an outbreak, on the effectiveness of response efforts, and on recovery. So what sort of effects would a pandemic have locally? Recent experience may lead us to feel unconcerned. The most recent pandemic influenza outbreak, the swine flu in 2009, was mild compared to others, with around 450 deaths in the UK. But infection and death rates are expected to be far higher in a future outbreak. Government advice to local authorities is to prepare for between 200,000 and 315,000 extra deaths over a 15-week period during a future pandemic. So we can expect something much more socially disruptive. There are things we can all do to be better prepared for the social impacts of a pandemic, which will play out at a local level. An important first step is for communities to work out how to handle the practical and psychological impacts and to build knowledge about local needs and resources. This could include working out how we might best respond to particular scenarios. For example, how would local businesses and services cope without a third of their workforce? Worker absence will be particularly problematic in key sectors like healthcare, social services, and energy supply. Our communities will be better able to respond to such a scenario if we have worked out in advance how we might support key sectors. For example, we could identify people with relevant skills and experience who could step in at times of high worker absence, and we could train volunteer support workers. A related example is to work out how the community might be affected if schools or public transport had to shut down. How many more people would be unable to work? Are there ways in which the community could organise childcare and shared transport to minimise disruption? And how might the community support those who, for example, will struggle to afford food without an income for a few weeks? It is not only these sorts of practical impacts that community activities can help to address. Building local awareness in advance may also help with acceptance of extraordinary measures needed to cope with the increased number of deaths and the psychological impacts of this. Death rates are expected to be between 2 and 5 times higher during the pandemic period. This will be distressing in itself, but will be compounded by the fact that mortuary capacities will be severely stretched, and that standard practices for funerals, burials, and cremations cannot be followed. Only finding out as a crisis unfolds that you cannot give your loved ones a traditional funeral service, or that a local community building needs to be used as a temporary mortuary, will likely be far more upsetting than if you had been informed about the likelihood and justifications for such actions in advance, and if the community had been able to consider options together. But currently, I think these are things that we mostly just have no awareness of. Such local community activities imply a sense of boundaries again, and we should be careful about who may be overlooked or excluded in such a process. It will also be useful for local communities to form networks amongst themselves and share experience and resources. These ideas about building local awareness and planning for catastrophes in advance will be really valuable for our responses to other disasters. Simply knowing about the resources, knowledge and experience available in your neighbourhood and having an idea of local support needs will more generally contribute to community resilience to disasters. Many people willingly volunteer when a crisis hits, and I hope we're among them. Our contributions will be more effective when coordinated at a community level and planned in advance. The range and complexity of extreme risks that humanity currently faces can, with justification, seem overwhelming and inescapable. Risks at this scale should strengthen our sense of global community, where physical and moral boundaries between people become irrelevant, while at the same time encouraging local community efforts as an essential first level of response. Separating out different sources of risk and different levels of response can make it easier to understand how we might address them. There are things we can do, and these things are worth doing. Rather than not knowing about these risks and therefore being unable to do anything to address them, it is better to know and to make efforts to respond. Thank you.